What you're seeing is a video of a preterm baby who is severely malnourished, acutely sick, and he's in the hospital about to receive a nasogastric tube. A nasogastric tube is a tube that goes from your nostril, your nasal cavity, all the way to your stomach, and it provides nutrition to babies that are so sick, as well as adults that potentially cannot feed for themselves. During this procedure, patients receive small amounts of medications to sedate them, make them feel comfortable, and to alleviate pain, while the provider is able to place this nasogastric tube that's very long all the way to the stomach. This procedure could be very comfortable for certain patients, especially for newborns. This poor baby, you could tell that they're very tired, and the provider is doing the best they can to get this procedure done in the most comfortable way for this patient. And here you're able to see that they're checking to make sure that the nasogastric tube is actually in their stomach, because they inflate the nasogastric tube and they hear for essentially air bubbles in the stomach. But ultimately, you'll get an x-ray to make sure that we could visualize the nasogastric tube in the right position in the stomach. We want to make sure that the nasogastric tube is not in the lungs. One of the issues with the nasogastric tube is that it could go into the lung. That's why we want to make sure we confirm placement by getting a chest x-ray to make sure that the nasogastric tube, the tip, is actually in the stomach and not in the lung. Because if you don't confirm and you start tube feeds, you give patients food through the NG tube and it's in the lung, it could cause them to aspirate and have a severe pneumonia, aspiration pneumonia. I hope this baby continues to heal and thrive.